75 years, you are in the early old age. And beyond 75, you become, late old age or very elderly. So you are elderly as well as very elderly beyond 75 years. Okay, now let's see how big is the problem of aged, or the size of the aged population is what we are going to see next. Okay, now do you think the size of the population of elderly is growing day by day? Yes, because the life expectancy in every country, whether developed or developing or underdeveloped, is increasing day by day. So what happens is the number of aged population is also increasing accordingly, right? The UN said that in the year 1998, around 9% were the number of elderly people at the global level. Whereas now, in developed countries itself, we have around 15% of elderly population. Okay? Around 15% is the elderly population. Just imagine how much big is the number of elderly people in our world. Okay, and we know that the proportion of elderly is more in the developed countries. But more people are living in the developing countries, right? So, the number of elderly people are more in the developing countries. So, what is the problem? Developing countries are already full of problems, right? And now they have to also cater the problems with the elderly. I'm not saying that the elderly is a problem. Elderly has some specific problems, or they are facing some problems because of their old age. Now, the developing countries will have to cater to that as well. So, that causes a lot of social and economic and health constraints for the developing countries. Okay, now, and we know that the country that has got the highest life expectancy is, yes, even now it is Japan. And in Japan, the life expectancy has gone up to 85 years recently. Okay, now let's see certain terms that you should be familiar when it comes to elderly care. You might have heard about gerontology, right? What is gerontology? We are actually talking about gerontology here. So what is it? It is a study of physical as well as psychological changes which are happening in old age. If you are studying about the physical and psychological changes in elderly, you call it as gerontology. Then you have something known as clinical gerontology, or what you simply call as geriatrics. That is, the health care we are giving to the elderly is known as clinical gerontology or geriatrics. Then the third is social gerontology. As you can very well guess, what would it be? I've already said that geriatric population is facing a lot of problems, not just health problems, but they also have some social problems. Okay, and if you are studying about the social problems because of the age population, you call it as social gerontology. And we have a kind of new term known as geriatric gynecology.